Megan, and I am the Field Marketing Specialist here at Intiveo, and thank you for joining us. Today is my first webinar, and we will be covering aligning patient experience across multiple locations. So I will just get into the agenda. So we'll be covering the patient experience, key elements of the patient experience, where software fits in, and then we'll go over our guide and test. If you look over to the right, we actually have a QR code here if you'd like to scan that, and we've created a worksheet for you. And you can take some notes on the webinar, and there are some questions at the end for you to answer. So without further ado, we will get into Nate's presentation.
Thanks, everybody. I'm Nathan DeVries. I'm the Chief Customer Officer at Intiveo. I'm very glad you're attending, and so please join us as we talk about patient experience. Okay. We spend a lot of time at Intiveo talking about the patient experience and how we can help your teams provide the most seamless process. In order for us to help your offices improve and streamline their process, we spend a disordinate amount of time getting to know our customers, their company values, and how that translates to the overall customer experience they desire. From the initial impressions of a new patient to preparing them for upcoming treatment and keeping them engaged after their initial treatment, all of these things and a lot more work in lockstep to form the ideal patient experience. So why does the patient experience matter? I could say that dentistry is a highly competitive market, and that would be true for most of you. But at Intiveo, we like to think a little differently. We know that a well-planned patient experience leads to much more than just a financially successful practice. It leads to a well-informed and happy patients who have much better treatment outcomes. As a member of the healthcare community, it is important that we are able to communicate with our patients efficiently and effectively so they come prepared and willing to do their part. Because I know that if we can help bring prepared patients to your office, you and your teams can do your best work. So values and alignment. If we all can agree that patient experience is essential to a healthy and growing practice, what are some of the ways that we can ensure that we are providing the best experience possible? I like to start with your team. I don't know if many people would disagree that the human element of the patient experience is the most complicated part to get consistency of. I always encourage businesses that are looking to get more consistency from their team members to publish their values. Values are like guideposts to how we should respond to things that our processes may not cover sufficiently. We need to ensure that everyone knows our values and is aligned with them. So let's dig a bit into that question. Does everyone on your team know your company values? Companies can have a bunch of different values and a different makeup of them. It is important. So some of the things that we've come up with is it to improve the overall health of your patients? Is it to improve your patient experience or appearance? Is it to maximize profits? Or is it to ensure that the community has access to the dental care, even if they can't afford it? There isn't a wrong answer, but has anyone ever explicitly told your team what yours is? Has anyone ever documented it for new employees? How often is your team coached on them? Most importantly, does your leadership team live out these values? Are team members empowered to make decisions that align with them? The truth is, if you have not formalized or articulated your values, your team already think they know what they are. They currently are making decisions and interacting with your patients based on that. So it's best to let them know so they act appropriately. So it kind of brings into the key elements of the patient experience. So most healthcare professionals, dentists included, know that they need to provide a positive patient experience. But what does that really look like? Let's talk about some of the logistic elements of the patient experience. Getting your team on the same page, patient preparedness, knowing how your patients feel, staying engaged. I think now would be a great time to kind of create a plan together to build out your practice's ideal patient experience. So get your team on the same page. I talked about this earlier. Let's get them on the same page. First, let's define our company's values. Depending on the size of your company, this will look different. There's so much great literature on the topic of culture and values and how they drive success for an organization. Read up on it, talk to friends, find out what you would like your practice values to be. And we can have a bit of discussion about that afterwards if anyone's interested. Then the second step is to get buy-in from your team and socialize it. Make sure that everyone in your team understands what your values are. You can have fun with the process, role-playing situations where your values might impact how you treat a patient. Making sure that patients understand that values aren't just lip service or words on a wall. They actually transform into the way that you interact with your patients. And if something's not super clear on how to do something, you look at your values as guideposts. Document the process and make sure that new team members are socialized to the values and how it impacts their work. In the today's employee climate, as new employees come and go, that's really where values can become distorted or lost. And so it's really important to reinforce that during your onboarding. We need to hold everyone accountable to your values so you have consistency across teams. So we now understand the what you do, dentistry. We now understand the why of our company, the values. It's now to define the how. We need to create a list of all the treatments and services that our offices provide to our patients, and then compile all the steps that are required for a successful treatment outcome. It is also very helpful to come up with a list of common reasons why specific treatments might fail, so we can counteract them. Some common things we hear are that patients arrive late, they're unfasted, they come with incomplete paperwork, they forget their wallet or are unexpected to pay, or they arrive without a driver, so for a procedure that requires sedation, and so we need to rearrange that. Gathering all the relevant information for each appointment is essential if you're looking for consistency. You need to communicate that information so your patient comes prepared to the appointment, moving them closer to a successful treatment outcome. Unprepared patients are the most frustrating and preventable issue that causes failed appointments. So the next one is knowing how your patients feel. Our patients are people too. Yeah, it's obvious. But patients choose healthcare providers who align with their values and preferences, usually in that order. Understanding who your customers are and how they like to be communicated with is essential. Customizing your systems to communicate the right message in the right medium dramatically improves patient compliance, which then they receive the benefit of a successful treatment outcome. I encourage offices to approach their patients with empathy. Understand that when they show up ill-prepared, it usually is a communication issue, not a malicious event. We need to better understand how we can improve our communication with that patient, and when appropriate, tweak our systems so it doesn't happen to other patients. Seeking direct feedback from the patient is often the quickest way to improve our process. Those feedback loops are very, very important whenever we're designing a system. And the last step is stay engaged. With your staff on the same page, a solid understanding of what it takes for a patient to show up prepared, and a strong relationship with your patients, you have the foundations to stay engaged with your patients. Encouraging patients to leave direct or online feedback is a great way of measuring and consistently improving your patient experience and ensuring high quality engagement, all of which lead to more successful treatment outcomes. So how does this uniquely challenge offices with multiple locations? It's an issue of scale. How do you keep your values and processes aligned across multiple locations? Some issues that we often notice are the number of teams that need to get buy-in. Often values or processes are rolled across a few trial clinics very, very efficiently. But as time comes to cross multiple locations, the balls get dropped. You often have a wide variety of services that change based on location. So procedures that you do might not be from location to location. And so you need to identify the changes in workflow based on your locations and the procedures each provide. And then your patient demographics might change dramatically from location to location. Obviously, a pediatric clinic is going to choose completely different, have a different demographic than your regular GP. Or maybe an OMS clinic. And so understanding who is attending your practice and the mediums that work most efficiently with them. Across the board, SMS is the most widely accepted, but depending on the procedure you're doing, email might be more appropriate. So all these things can be overcome with enough planning. And so really, I think as we scale and we bring in more and more locations, we need to be way more methodical. We need to have well-defined values and processes that are documented and supported by leadership teams who live the values themselves. This is key. You can have really great values and you can have those processes that are documented as well. But if your leadership team doesn't actually live out those values, the frontline staff won't, and your patients won't feel them. And so it's kind of a lost exercise. So once you have your support structures in place, which are going to be required in order to make sure that your values and your processes follow all the way through, you can put in place software that reinforces those internal processes and tracks when a location is missing the mark to make life easier. Following up on less than ideal performance quickly, reinforcing your values and the need to follow process ensures lasting consistency. Allowing team members to make decisions based on your core values is really important. The larger an organization gets, the longer it takes to make the right decision quickly. So let's talk about where software fits in. Obviously, we work for Intiveo, so I'll talk a little bit about how we do that. So implementing new software and technology. At Intiveo, the first thing we like to do is get to know your practice. Understand your values and what is required for a successful treatment outcome for every service you provide. It's a lot of work up front. We need to know how you operate. Is it under one unified brand? Or does each location have its own brand? Or maybe it's a mix of both. We've dealt with all of these, but all of them change the way that we will implement the application to make sure that you have consistency across your brands. Identifying the tone in which you speak to your patients. We are communication. We do a lot of communication. And so making sure that the way that you talk to your patient is the same way that we talk to your patients. This usually aligns with your values or your brand as well. Understanding if you use the same PMS or multiple across your group early can help save time when we centralize your data. So depending on how many different PMSs you have, the solution may vary a little bit from location to location, but trying to make sure that they have consistency regardless. So the biggest thing is having a dedicated team on both sides that understand the goals of the project and how to implement them is essential to a successful rollout. Leadership matters in these sorts of things. Regardless of the size of the organization, having leadership buy-in across all levels of management is essential. Teams need to be aware of why there is change and how it aligns with the team's goals. Great leaders can help facilitate communication and provide a vision of what your team can achieve at your practice or within your organization. Often the easiest way to get buy-in across large teams, as well as streamline the rollout process, is to make sure you have an implementation team on your side to help with the decision-making and rollout of any new software. We often see that this could include a marketing manager to make sure that your brand is aligned. It could be a regional manager to make sure the organizational goals are aligned. And then often an office manager or two to make sure that some of the smaller, lesser known processes are included. For smaller groups, it might just be a trusted team member in a leadership role. Regardless of the size of the organization, it's really important that you have someone on the team that is authorized to make decisions. So the process isn't always going up to a committee who aren't involved in the actual rollout process. Everything just works a lot more smoother. And then centralized data. Once you spent the time up front, the awesome part about this, especially for those who are using different CRM or PMSs across all their locations, is you now actually get a nice unified data set. For people who aren't using cloud software, this might be the first time that you can see this scorecard, as I like to call it, where all your data is centralized and you're able to see how your organization is doing as a whole, as well as how locations individually are doing. So you have to think to yourself, what are the metrics our organization needs to track so that we know that we are successful? We know that our values are being followed or that our customer experience is great. Once we know what you want to track and we have everything implemented, we're able to have all of our data in one place and monitor these metrics. And then obviously the most important thing is that once we are notified or know them, we're able to respond efficiently and quickly to them to make sure that we keep a high level of quality across all of our locations. And so I know that we created a bit of a worksheet for you to jump and take a look, and we have some questions on there that you can read. So feel free to pull out your worksheets. As well, if there are any questions at all, or if there's something you want me to dive a little deeper into, now would be also a great time for you to use the chat to ask the question. Awesome. Well, I'd like to thank you for your time. It's very appreciated. If you want to follow up afterwards, feel free to reach out to our, I believe it's info@intiveo.com, and I'll monitor that for any questions that might come in.